Okay, Kobe, as you have mentioned, genetics play a very important role in the development of cancer. But we are saying cancer is actually an abnormal multiplication of cells. And you see, for these cells to multiply abnormally without being cut from the link, it's because of the DNA. So most of the cancers that we are seeing actually occur sporadically. But there's also another side of cancer that occur as a result of genetic inheritance. Okay. So most of these genetically inherited tumors, we see them in children, like you have seen here. Retinoblastoma is actually a cancer that affects mostly the children. Okay. But 80% of most of these tumors occur sporadically. No one knows the exact cause of cancer. We can only talk of risk factors. So some of the risk factors that are causing these cancers to flare up is like Dr. said, smoking, use of alcohol, our diet, high in lipid, and then we also find that people are not exercising. Yeah. If you don't exercise your body...
We're all sitting in traffic.
Yes. But you see, you need at least active exercise 30 minutes every... 30 minutes
3 times a week?
Yeah, at least 3 times a week.
Okay.
Yeah, but now, talking of treatment, one of the treatment of these cancers is use of chemotherapy. Most of the people, when they come to us, they ask, what is chemotherapy? So we are trying to break down the steps.
Can I come over there and see that?
Yes,
Dr.
you can
let's
come.
go. Okay, you can leave your stuff. You're okay. All right, let's just see what you've got. Globus, are you learning? Yes, I am. Me too.
So we are breaking down the steps of chemotherapy.
Okay.
So first, when the patient comes, we have to check the blood levels. Okay. Because some of this treatment, you see, it has side effects toward the bone marrow. Yeah. And it's the bone marrow that produces white blood cells, red blood cells, platelets. So we have to check.
Chemotherapy sounds very painful. Is it?
It's not painful.
What are
it's
the,
just
what are
like
the
you're getting a drip.
Okay.
For example, someone who is vomiting and diarrheaing a lot and they need a hydration through the drip, chemo is just the same.
Dr. but doesn't chemotherapy cause nausea?
Yes.
Lack of energy?
The side effects of chemotherapy, I'll talk about that. Okay. It's down there. But then after now we have checked and your blood levels are okay. Yeah. The next thing is that we channel you towards the chemotherapy center. Okay. Here cannula is fixed, and then you start with hydration. We have to hydrate you first. And then number 2, we give you the pre-medications. You talked about the side effects of chemotherapy. Yeah. One of the side effects of chemotherapy is that somebody may vomit, somebody may diarrhea, somebody may also have other effects like general body weakness. Okay. So we give you medications to prevent that. But then there are other side effects that are long-term, but still these side effects are temporary. You resume normal life after that, like hair loss. Your skin color changes, like you may become a bit darker. And then the veins where we used to inject the chemo, they also may get a bit darker. Okay. But these side effects are temporary. Now the chemotherapy, as I said, we give it through the drip, just like a normal drip.
How long does it take?
Normally, it depends with the drugs you're getting. Okay. But it's between, like we can say, 1 to 4 hours. Okay. Yeah, but there's some chemos that may take even 46 hours.
Wow.